Good afternoon, everybody, and thank you to IPS for stretching the definition of young. Although I've been reassured that I'm not here because I'm young, but because I'm involved in mental health. Although for many years I've thought that the definition of young should be my age or younger. No one has been persuaded yet. This conference, the theme, mental health, is quite relevant. It's something that we've been occupied with for some time. When COVID-19 struck, we were really quite worried about the extent to which this would affect our mental health, our mental resilience, the extent to which isolation, quarantine orders, separation from our loved ones, what would the lasting impact and the lasting effects be? And so we had the COVID-19 task force around mental health, the COVID-19 mental health task force, I should say, not the main task force. And then that informed the work that we did around the interagency task force on mental health and well-being, which we heard discussed at some length by the panel. There were a lot of lessons learnt in those few years. And I think it's worth spending just a little bit of time thinking about those lessons. For example, going into COVID, we assumed that our seniors, the elderly, those who were socially isolated, would have great difficulty in coping with the circuit breaker, with the increased isolation that was enforced. And we assumed that young people, digital natives, people like yourselves, would do rather well when we shifted everything online and classes went online and work from home. And now, people like my sons who wanted to spend more time online were told, please do everything online. And we also assumed that the pandemic and the difficulties of the pandemic would leave a mental scar on us socially as a nation. Actually, all three of those things proved to be not quite correct. The seniors, our data suggested, actually coped rather well compared to the average population. They had a certain grit, a certain resilience, a certain, let's just deal with it, perhaps because of their life experience that they had gone through. Young people were particularly badly affected and actually didn't like doing everything online all the time. And coming out of the pandemic, craved for a reintegration back into real-world society, looking for opportunities to reconnect. And as a society, we bounced back rather better than we had anticipated back in 2020, socially. People went back to behaving with each other in person, without masks, shaking hands, going to large events, crowding out stadiums and various other venues, and then this whole thing has faded back into a fever dream. Why do I spend a bit of time saying those 3 points? Because sometimes our assumptions need to be challenged. Sometimes going into some of these difficult situations, it's worth then having a little bit of humility that we don't quite know which of our assumptions are correct, and only time will tell as we collect data, as we have the experience, and as a society we react, or individually we adapt. And I think the changes that we are seeing in mental health may be a little bit like that, as we ask questions about what's the right amount of social media exposure. Is it a boon? Is it a bane? At what age should we start having these conversations? Can we overdo it? Are we under-exposing our children to mental health literacy? All of these are new spaces, and some of our assumptions about what is good or what will work will need to be challenged. Time will tell. We have to go in with a sense of humility, but a sense of collecting data and establishing robustly whether our assumptions are correct or incorrect. For example, the 2023 National Population Health Survey reported an improvement in the mental health of the general population between 2022 and 2023. I don't think you would have expected this if I asked you in 2021, what is next year's National Population Health Survey going to say in mental health? I think an improvement would be the last thing that anybody would have reported. And certainly, as I was chairing the interagency task force and we were doing the work, that was not the sense on the ground. But that's what the data shows. However, younger adults aged 18 to 29 years old remain more affected than other age groups. About 26% of them reporting poor mental health. So we have an improvement, but as has been said before, and I quite agree, plenty more work to be done. There is a marked increase in the proportion of Singapore residents willing to seek help from healthcare professionals. Now 63% in 2023, compared to 57% in 2022. Again, I think going into 2022, 2023, if I had asked you, how quickly will we shift stigma so that people in Singapore are going to be willing to go and seek help and express a willingness to seek help? I don't think I would have said about a 20% increase in the next 1 year, but that's what the data suggests we were able to do, 22 to 23. Some of this is because the transition from childhood and adolescence to young adulthood it's a time of change, it's an exciting time, and it's a time when we start new relationships, we start new goals, our lives change quite considerably. And what we know is that that period of transition and change now extends quite late into your 20s. The way in which our lives work is not quite the same. People have sometimes dismissed this as a protracted adolescence, if you're trying to go with the glass half empty. But it is the way of the world. And the reality is that even 40-year-olds and 50-year-olds, the pace of change is quite different. And so that transition from adolescence, young adulthood, into a settled life, as it were, or having some sense of yourself, now takes a little bit longer. And so the period of time over which us as individuals face challenges as we navigate life's major milestones and take on new responsibilities is increased. And so, get back to the data, perhaps that may explain why it is the 18 to 29-year-olds who remain more affected around mental health challenges. The changes in life are over that time period, and some of these adjustments can take a toll on mental well-being. But not every setback, not every stressor that we face, not every life transition that we find difficulty in results in a mental health condition, nor is it caused necessarily by a mental health condition. And not every case of poor mental health requires an intervention or a medical intervention. There are normal stressors of life. There are mental health symptoms that we experience on a day-to-day basis. Not all of them require an intervention, and not all of the interventions need to be medical. We need a broad set of strategies to ensure that the right care is delivered to individuals based on their needs. And that's why our national mental health and well-being strategy focused on strengthening capabilities across the entire spectrum of care, schools, workplaces, the community, as well as healthcare settings like polyclinics and general practitioners, so that we can provide timely support, render that timely support to those who need it most in the right way. I would point out that listening to the earlier discussion, I'm very excited to hear that the tiered care model got so much of attention and people were paying quite a lot of attention to the details. I'm very heartened by the interest. It is an important piece of what we're doing. But the tiered care model is only a subsection of our national mental health and well-being strategy. It is an internal organizing framework for how professional services, voluntary welfare organizations, educational institutions, professionals and volunteers can integrate and work together. It certainly should not be seen as a way in which we label patients and clients and families, nor diagnoses, concerns or anxieties. And again, it's not a badge to be placed at the front of healthcare institutions or community institutions. It is an internal model for organizing what we do. I'm glad that there's so much attention, but I just thought I need to register the point that, you know, it's the 20% that got 80% of the attention. But there's a lot more to the strategy, and I would encourage that we think of it as a larger strategy, which will require quite a lot of coordination of many, many moving parts. And to do that coordination, and to coordinate especially our partnership efforts more effectively, as part of the strategy, we are setting up a new National Mental Health Office. And it will have officers from Ministry of Health, MSF, Ministry of Social and Family Development, as well as MOE, Ministry of Education. It will be fully established and will stand as an office on its own in 2025. But the officers, the personnel, and the work is already in existence, because we've had the Interagency Task Force on Mental Health and Wellbeing. Well, the officers would pulled from the same ministries, the resources were pulled from the same ministries, and we're looking to then, in setting up this office, to institutionalize some of that cross-disciplinary, inter-ministry, inter-agency cooperation and collaboration, as well as the networks that we have built with many, many partners, some of whom are represented in this room. So, taking the work of the task force and institutionalizing it in the National Mental Health Office. Akan datang, fully established 2025. But addressing mental health issues effectively requires both upstream as well as downstream interventions. We need to think about population measures. We need to think about measures to address people who are well, build up resilience. But we also need to recognize that you need crisis intervention and downstream interventions. An upstream effort to mitigate the risk of poor mental health among youths, one effort is to build up resilience from a young age. This type of resilience is going to be important whether you have a mental health challenge or not. And the truth is, you can't tell ahead of time who will have mental health challenges. And that sense of resilience then is going to be very useful for us as a whole, as we deal with the stressors of life, or if we ourselves have mental health challenges. These are skills that we can teach young people to have, to overcome adversity, and develop their approach to manage the stress of life and life's uncertainties. Schools do this today. They have a deliberate approach among students to build up mental resilience through the character and citizenship education curriculum. And our institutes of higher learning also have a curriculum and a deliberate approach to address these same needs. And these experiences, this learning is reinforced through experiences beyond the classroom, co-curricular activities, learning journeys, outdoor adventure learning camps. All of this, if you asked, is your CCA about mental health? I would never have seen my CCA as being about my mental health. It was about playing that game or doing the sport or getting engaged with the community. But the way in which we make sure that children have access to CCAs, the way in which we make sure that there are non-academic activities available at every stage of education, and we integrate that into the life of an educational institution. How that is done deliberately, and that is part of thinking through the social resilience of that community within an educational institution and the mental resilience of the students that are there. And so I just want to draw attention that there are many, many things out there which are structured in the education space with a view to building resilience, with a view to building well-being in the broadest possible sense, but are not explicitly labeled as part of mental health and well-being. But it is how the educators and the people who run our education system think. Workplaces also have a huge impact on our overall well-being, particularly for young people who have just entered the workforce. The transition from your education space in the schools and in the institutes of higher learning, you might have peer support structures to help students look out for each other, foster a supportive environment. And so then into the transition into the workplace, if you are benefiting from this type of structure, this can be a jarring transition or a transition that you may find very difficult to cope with. And so the stressors of your workplace can be significant, and studies have demonstrated close association between work stressors and mental health. And so we want to improve, we're committed to improve the mental well-being support systems and work-life harmony strategies for employees. As a government, we want to increase employers' adoption of mental well-being initiatives. We want to enhance support networks within the workspace. We've recently expanded the Tripartite Advisory on Mental Health and Well-being, which provides practical guidance to employers on how to better support their employees' mental well-being. We've developed a playbook on workplace mental well-being and helping them guide the employers to develop specific implementable strategies. And we've also started the Wellbeing Champions Network, bringing together a community of management-level staff, passionate individuals to exchange best practices in promoting workplace mental health. To support employees with mental health challenges, several companies already provide counseling services through employee assistance programs. Health Promotion Board also offers training and workshops for employees to better cope at work and support their colleagues. In 2023, more than 55,000 working adults have benefited from HPB's mental wellness programs. Another area again, the panel touched on earlier, is social media. There's a growing concern over the widespread use of social media, especially among young people. And we are developing a positive use guide. So our approach is to think that there are some aspects of this technology, some aspects of social media, which are beneficial. How do we explain which are the beneficial aspects? How do we provide that kind of guidance? And so a positive use guide is being developed, providing recommendations on how to mitigate the negative impact of technology and social media use, and ensure that young people can navigate the digital space safely. Making it easier for youth to access mental health services will facilitate early detection and intervention. Today, there are over 200 mental health touchpoints in a variety of forms: hotlines, text or email platforms, digital resources, in-person services. It can be quite overwhelming for someone who needs to navigate these touchpoints. So we're working to simplify this. Our plan is to designate first stop touchpoints that will direct individuals to the most appropriate services based on their needs. Our first stop touchpoints will include, firstly, a number to call or text; secondly, a digital platform with online resources; and thirdly, a physical location where you can go to seek help. So you need to do all three in parallel, because no one of these services will address everybody's needs or concerns. Some people will want to call, some will want to text, some will want to go online to search for their own resources, and some will want to turn up to a physical location, speak to somebody. So we will set up a new national mental health helpline and text line service. This will be operational by mid-2025. This service will offer psychological first aid for individuals facing general mental distress. Through phone or text, trained counselors provide support, will address common mental health concerns, offer a listening ear, along with brief counseling for those dealing with challenging situations or displaying mild symptoms of mental health conditions. Anyone requiring more extensive, long-term mental health support will be triaged and referred to the relevant mental health services. So it's not just where do I get help? You will have that first, not just connection, that first level of support, psychological first aid, counseling, provided some advice, as well as then a connection downstream to a more substantive treatment should you need it. And not everybody will, but for those that do, there will be further treatment available or further assistance available, not necessarily a medical treatment. And this approach facilitates early intervention, helping to reduce the treatment gap, as well as preventing that sense of over-medicalization or unnecessary escalation of care. You want to balance ease of access, getting people into contact with a professional quickly, swiftly, in an easy way, but do so in a way that does not automatically mean a medical escalation, especially if a social intervention or a community intervention would be more appropriate. The helpline will be a 4-digit number. People will be able to remember it easily. We're working with relevant agencies to streamline existing hotlines that offer similar services. And we observe that some individuals may prefer seeking help via text message. So this service will also include a text line hosted on mindline.sg, which we hope will encourage more people to reach out for support in a way that feels comfortable to them. We're also going to be streamlining digital resources. The public can access digital platforms such as Mindline or MindSG. These provide curated content by mental health experts, as well as self-assessment tools for the users. For those who prefer a personal interaction, we will build up and promote in-person first stop touchpoints through our community outreach teams, also known as CREST teams, and the CHAT, the Center of Excellence for Youth Mental Health. Specifically, the youth community outreach teams, which known as CREST Youth, conduct outreach to raise awareness of mental health issues and identify youths who need support early. Over the next few years, we will continue to expand these teams across the island. And the young people may also approach CHAT, which is our National Youth Mental Health Outreach and Assessment Services, to receive mental health checks, intervention, and outreach services. So, as a government, we are fully committed to doing more to improve the mental health and well-being of Singapore. The launch of our strategy was not the closing of the process. It was the launch of the next phase of operations, services, programs, integration across a number of agencies and ministries and services. It was a way to then frame our approach going forward. But for all these plans to work, we need to do more as a society to improve mental health literacy. We need to continue to normalize conversations around mental health, and we need to destigmatize mental health conditions. I'm very encouraged by the impactful ground-up initiatives of our stakeholders. These have been instrumental in breaking down the barriers to mental health support. These include Beyond the Label movement by the National Council of Social Services, the It's Okay to Reach Out campaign by HPB, and online resources such as the ones that I've mentioned, MindSG and Mindline.sg. So thank you very much for inviting me here today to have the opportunity to share some of the things that I'm passionate about and have been working on together with many colleagues and friends for a couple of years. And I think it continues to be an important issue for us to tackle, to go forward, to build a more resilient and supportive community. And I look forward to your questions and our conversation later. Thank you all very much.
Hi. Okay, cool. Thank you, Hazim. We are excited and honored to have SMS Janil here with us today. Both in our offstage conversation as well as in your opening address, you were rather intrigued by your involvement in the Young Singaporeans Conference. But as chair of the Interagency Task Force on Mental Health and Wellbeing, I'm sure you will be able to provide, highly likely, some answers or some guidance to the burning questions that our participants would have today. So I would invite anyone and everyone who has a question today to step up to the mics that are around the room right now, or you can also drop your questions online through Poll Everywhere. If you do choose to use the mics, do let us know your name as well as your organization.
While you're getting the first question sorted out, just as an extension of the last set of comments that I made, is a realization as we did the work through the Interagency Task Force, we felt that there was a need for a specific track of work around youth mental health. And so some of our work groups, some of our consultations were about youth mental health, and there was a recognition, I think, with many of the people that we were working with, that the issues to do with mental health for the population as a whole, not all of them applied to young people, and that there were specific matters that we had to deal with targeting young people. However, it was also clear that young people are not homogeneous. That there is not one set of solutions that you can just have for young people, or that they are automatically represented by one set of views or one set of organizations. There is quite a lot of diversity and heterogeneity in the youth space in general, and in mental health, like in so many other things.
Okay, cool. So I think I'll pick up like one of the questions that we have from the audience, and also like a personal question, which is the one on the largest challenges in forwarding initiatives for youth mental health. So like my question would be about, like, from your perspective as a policy maker, like what are some of the challenges that you think the government is facing channeling resources like from the institutional level on the ground to people who either want or need mental health support and help?
Well, I think the largest challenge is not so much about channeling resources. That in a way, we have structures and processes around how to channel resources, and it's something that the civil service spends a lot of time thinking about, and public sector agencies spend a lot of time thinking about. The largest single challenge is attitudinal shifts, mindset shifts. That's not something that you can do easily through, or at all, through policy. You have to do it through a lot of other efforts. And so that today continues to me to be the biggest challenge. If you wanted to focus very specifically on the processes of government, other than, for example, attitudinal shifts, I suspect not today, but I can imagine maybe midterm, a few years from now, one of the larger challenges will be asking ourselves, what works? You know, how do we measure success? How do we think about what's working? Where do we allocate our resources? Which initiatives should we fund more? Should we fund less? At the moment, many of the things that we're doing are nascent. They're pilot ideas. They're things which haven't been done before, so better do it, learn how to do it. But I can imagine in the medium term, working out what has done good, what has worked well, will increasingly be something we have to pay attention to. So I think short term, shifting mindsets; medium term, defining and measuring success.
So there's also a question that I think has been brought up by the groups as well as our panelists earlier today. So it's the question on caring for our caregivers, right? So currently, what is being done to care for the mental health professionals in Singapore?
Well, this is not only about mental health professionals. I mean, this is an issue for caregivers looking after the senior care sector, working within our hospitals. We have a wide variety of programs looking at how we can create processes and platforms within the workplace. And so we're quite fortunate that a number of our healthcare institutions, as well as our educational institutions, as employers, want to be able to then put these structures in place. In other words, while they are working within the mental health space, they understand that as an employer, they have to look after their employees in a particular way. And it gives us the opportunity then to try to develop these right processes within institutions and with employers that have a vested interest. And they have a vested interest partly because they are delivering these types of services, and partly because their employees are the healthcare workers and mental health workers that understand these issues best. So we are watching this, and we're paying quite close attention, and I hope that we can learn some of these lessons and then demonstrate to other employers that this is very doable.
Is there no one here that would be willing to get up to the microphones here?
Hello. Hi. Hi, Dr. Janil. I'm Colin. I'm from IPS. I guess the question I have is kind of like a meta one, right? So I'm just thinking from kind of like a social linguistic perspective, right? You know, when we say mental health, sometimes like mental health, sometimes people flinch a bit like, oh, what kind of conversation am I going to get into? We here in this audience, at least, we can speak about mental health and these topics in English very well, right? And we can express a lot of like complex topics based on like our lived experience of how we interact in our daily lives in English. But I'm kind of thinking about other populations as well. For example, people who are more well versed in their, native mother tongue. How can, the nuances and tenets that come from whatever we know of the English mental health speaking will be extended to these populations as well?
Colin, it's an excellent question. Thank you very much. It's something we've paid a little bit of attention to, but perhaps we need to do more. There's no short answer to this, because it applies to actually many, many aspects of what we do. And it's not only about mental health, right? There are many things where the outreach to communities needs to be stepped up, and it needs to ideally be done in a language, but also in a manner in which they are much more familiar. And our experience so far is this is not about merely translating resource materials. Actually, it's about mobilizing a network of volunteers, doing retail operations to go door to door to the people you know you cannot reach through other means. And this applies, as I say, not just to mental health, digital literacy, isolated seniors, access to services, and a whole bunch of other things. So specific to mental health, we are mobilizing, and we are going to try to mobilize more organizations that engage with, well, communities who are more familiar in their mother tongue, for want of a better word, right? And those don't necessarily need to be mental health volunteer organizations. And that's one of the issues that we have to think about. You're right. In this room, who comes are people who are already working in the mental health space, but they may or may not be doing so within that, let's say, the Chinese-speaking community, the Tamil community, Malay community. Although there are some. I mean, Lepak Conversations is here. They talked about it. There's a group called, the chap that runs it, Davies, his name, Mental Act. And they reach out to the Tamil-speaking community and so forth. There are groups that are doing this. How much can we multiply their reach? Well, there may be a limit to scale. Another approach is to then work with organizations that are doing all kinds of other work, but have a large network, let's say within the Mandarin-speaking community or the Tamil-speaking community, and infuse mental health capability and mental health skills in some of their outreach work. And that's certainly a track of work that we are pursuing. You perhaps know that I'm chairman of the Interagency Task Force on Mental Health. That's stepping down. Then there's another organization dealing with mental health, which has announced a new mental health group. I'm not sure I can say the name, otherwise the civil servants might get, but there's a lightning involved, I'm just saying. So we have a mental health group, and one of our specific tasks under that mental health group is to reach out to mother tongue language communities in order to then be able to drive this message home. We think it's very, very important.
Hi, Dr. Janil. I'm Yudia from Rice Media. So I think a lot of us have talked about changing mindsets in terms of like finding meaning and identity in life and career. Like that's happening throughout the world, right? But I'm wondering, like in reality in Singapore right now, you still see a lot of people oversubscribing to certain schools and also having this narrative of what the Singaporean dream or ambition looks like. So I kind of want to ask how you think policies could be implemented to adapt work culture as well as like education, the education system, to adapt for changing times and needs.
Well, this is a big part of Forward SG. I mean, what are the aspirations of the next generation of Singaporeans? And if the next generation of Singaporeans have exactly the same aspirations as their parents, well, firstly, it's unlikely, but it suggests that a sense of progress isn't there. But we know that the aspirations are changing. And how do we then think about policies and the structure of what we support in order then for those sets of aspirations to come to the fore? Aspirations like what you have articulated. So the short answer is the TLDRs, read the Forward SG report. But that's not that I want to get out of answering your question. We are making shifts in the education system. Prime Minister Lawrence Wong spoke about that at NDR. The workplace is harder to do by policy. It's harder to do by policy. Education, something we control. We can have ongoing national conversations. We can try to explain to parents. We can tweak policies here, tweak policies there. But workplaces, by their nature, have a certain competition. Even if there's no internal competition within the business, the fact is that business is competing with another business. Either for market share, profit share, but businesses are also competing for a share of manpower, and especially talented manpower, and especially local manpower. So actually this is one of those spaces where the constraints that we have on local manpower may well be an impetus for businesses to then start thinking about some of these things in a way where they can be competitive in order to attract the manpower that they need and want. I mean, ultimately, if the workplaces are undesirable and unattractive, you will go and work somewhere else. I presume there must be a reason why you are with your employer, and increasingly that may well be a differentiating factor which may help this conversation move in the right direction as well. We're already starting to see this with larger companies, and companies with resources know that they must address that sense of boundaries and mental health and support structures, especially for new hires and their younger workers. Otherwise, people are not going to work for them. And that needs to then become something that smaller employers also think about. We have to make sure that they have the support. And so the tripartite alliance that I spoke about in my speech, some of the work that the unions is doing and MOM is doing, is to then support SMEs to be able to then start thinking through some of these provisions to be able to be better employers. And I think that can go a long way towards shifting mindsets in the right direction.
Thank you.
So I think a related question is also one of the top voted ones. Is it possible to institutionalize a 4-day work week to reduce workplace stress and burnout?
Well, it's possible, but it may not achieve your outcome. And I think that's the first thing we have to think about. And there are places where it's been tried and not always with great success. Look, I mean, I won't ask you who your MP is. Who asked the question? I won't ask. I mean, are you okay with your MP to have a 4-day work week? I mean, I'm not sure my residents of Punggol Coast would want me to take 3 days off. It's a 24/7 job. But I say that jokingly, because in order to do this, we'd have to substitute many types of services for that extra day off. There are ways in which you can reduce your individual exposure to the work, but potentially the work needs to be done by someone. And so then we as consumers, clients, residents for an MP would still want that service. So I think it's one of those things where a little bit 6:30, glass half full, glass half empty. I'm not entirely sure that it is the right question to ask. It's, you know, you could say, look, do you want F&B outlets to be open at night? Their workers would like to go home and be with their families. I mean, it's easy to make the case if you say healthcare or emergency departments or the policemen, right? You understand, okay, it's got to be 24/7 all the time. But let's not go all down. We just talk about hawkers. You know, how forgiving are we going to be as consumers if hawkers didn't work the hours that they do? And what would be the substitute that we would need in order then for that service to be maintained if their working hours were less? And how much more would we have to pay in order for them to recoup their revenue within the shorter working hours that they have? So not a straightforward answer. So the TLDR, is it possible? Yeah, possible. Is it going to work? I'm not entirely sure. But is it the best possible solution to the problems that we face? I think there's a lot of reasons to doubt it so.
So one of the goals and the objectives of the Interagency Task Force is to increase the number of mental health professionals that we will be having in Singapore in the coming years. So once again, one of the top voted questions, right? So what progress has been made to increase the number of mental health professionals in Singapore? And by extension, how soon can we see actually a reduction in perhaps the waiting times at our hospitals, as well as at IMH, as well as to increase or to improve the accessibility of mental health services for Singaporeans?
So just a short, multifaceted question there. No. Thank you. Well, it's already started. Not so easy to train healthcare professionals. You know, the time cost to train a psychologist is quite long. You go to a basic degree, you go to a postgraduate degree, and so you know, we announced our strategy in October last year. It's going to take some time for us to see an absolute increase in numbers. But by 2030, you'll see a 30% increase in the number of psychiatrists and a 40% increase in the number of psychologists. And so that's the kind of delta that we're looking at. Today we have about 200, just over 200, both psychiatrists and psychologists in Singapore, and 30% and 40% increase by 2030. Not so far away, but it's going to take us several years to get there. Ultimately, the issue of capacity and waiting times is not going to be solved primarily by just an increase in the number of psychiatrists and psychologists. It's a component, but it's not the only one. The main bulk of the delta is going to be about making sure that services are right-sited, so that IMH is not the first and only touch point. It's not the place you go to and then you funnel out from there. And hence, increasing the number of community services, increasing the number of other healthcare professionals that can provide psychiatric and psychological services, and hopefully reducing the need for these types of crisis interventions is a key part of our strategy. So the issue is not so much when will I see a reduction in the wait time for IMH. I mean, today, if you need urgent care, you will get urgent care, and part of that is because you phone up and you have to bypass the queue because you have an urgent need. But why is the queue long in the first place? Perhaps there are people who could be best served by resources that are located closer to them within the community rather than at IMH. And that's the shift that we need to make.
So perhaps stepping back as like in your position as chair of the task force, as well as representing the government. So what do you do to maintain a positive mental health amidst your busy schedule?
Well, okay, this is one of those, you want the short answer, the long answer, you know? You've guessed by now that once I have a microphone, I tend not to give short answers. So this is I can do a variety of things. I like to run, but I'm a bit of a recovering runner. I have a bit of plantar fasciitis, hence my rather elegant footwear. So running, exercise helps me partly to just leave my phone behind and not answer WhatsApp messages. But also I find that exercise positively impacts my mental health. I find having a routine helps. So not so easy in a profession which is almost by definition routineless and reactive, and depending on who files what questions and what happens on the media. So there are little parts of my life which I try to make sure I have a routine. Breakfast is one of those things I have a little bit of control over. So wake up at the same time and have breakfast with my kids, my wife. There's a little bit of a routine there. So some structure where I can sort of reliably know that I will have a little bit of time and control over the effort, and then putting aside a little bit of time every day. I like to read, and so before I go to bed, it's actually after I go to bed, but after I put my phone away, then I make sure that I have some reading time, and then so these little things like this I find helps. But ultimately, having people to speak to about whatever challenges I have or whatever help that I need is a big part of it as well. I don't know if that helps or doesn't help. Answers the question.
Yeah, I think this resonates with what panel one mentioned also. Like, I think perhaps there are some simple steps that we can all take to just improve our personal mental well-being and health. So having sufficient sleep, exercising, having a good diet, and then perhaps you're having a routine that gets you some certainty in life would actually go a long way. So I think our next kind of top voted question is about how the mental health landscape now is perhaps a relatively crowded one. And this might actually relate to perhaps awareness and literacy about where and how to seek help. So at least from, I think, the perspectives of a few participants here, there are quite a lot of duplication in mental health help and services in Singapore. So it could be said to be program rich, system poor. What do you think are the specific gaps or perhaps things that we can do to synergize, to synthesize the current ecosystem?
No, that's a very good question. And it speaks to something that's at the heart of the strategy that we launched, which is that we can talk about the tiered care model, we can have all these recommendations, but it's how do we get the various partners to do the partnership? It's not enough just to say we have tons and tons of partnerships. What does partnership actually look like? What is the operation or the service that brings that partnership to life? So there are a few components to this. The tiered care model, the start of it is an understanding of what services and what capabilities should you bring to bear as a partner within the mental health ecosystem. If you say you're a community partner, these are the things that we expect that a reasonable expectation is there as a citizen, as someone with a mental health challenge. I step into your office or your center. What can I expect? And then if you say that you have a professional, someone with a license, a regulated professional, a psychologist, a trained therapist, a psychiatrist, what are the standards? And so having some sense of standardization. It's not about making everybody the same, but understanding what is the language of the services that you offer. What then is derived from that? What is derived from that is then how do you then make referrals? So if I want to then have a patient or a client referred out from IMH into the community, well, can we agree that this is the right place for this person? So that you understand what is it that you are receiving as a client, and then the client understands what it is that they are receiving by relocating their service provider from IMH to the community. Coming out from that then are a series of recommendations that we have in place about digital platforms for the professionals to do referrals, information sharing for the partners to then cross-refer and get clients the kind of help that they need. Also coming out from that is a national mental health competency framework. So today, if you say I'm trained as a therapist or I'm trained as a counselor, do you mean the same thing as every other therapist and every other counselor in town? And the answer is no. And there needs to be some common language about the competencies that various different professionals bring to bear. We don't have to reinvent the wheel. Many training programs that are out there, many courses that are out there, but how do we then map them to each other? So this is another important part of the partnership coming alive. So if you see yourself as a mental health ecosystem partner, or your organization sees itself as a mental health ecosystem partner, you're here in this room, and you want to know what are the specific gaps in the partnership, how do you come alive? I hope that you can go back, or you are already thinking about What are the competencies I need to train my team in? And how does that plug into the National Mental Health Competency Framework? What are the referrals that I need to make? And so how might I standardize my referral processes and information sharing so that onward, as my client goes onward, the correct information follows him or her? And then what are the capabilities and services that I offer so that I can then accept referrals in from other parts of the ecosystem so that clients can be right-sighted as close as possible to their area of need. And so that's, I would say, the gaps that are coming up.
I think there's a gentleman there who has a question and has been waiting for a while. Yeah, so feel free to just stand by the mic so that I know you have a question for SMS Janil.
Hi, Dr. Janil. So I'm calling from the strategic planning team at the Health Promotion Board. A bit of the context and probably another perspective to mental health provision. We've actually been exploring how we can design living environments that naturally support well-being. It's clear that while clinical services are essential, the physical environment where youth live and grow up plays a significant role in shaping their mental well-being. A lot of today's conversation actually focused on digital solutions and also clinical care, which are crucial. But we also need to consider how urban design and public spaces can act as preventive measures, particularly for younger population who spend much of their time in places like schools, neighborhood, and public areas. So my questions are, with government bodies like MND, like the Centre for Livable Cities, and URA shaping these physical spaces, how do you see Singapore embedding mental health support into our built or living environment? And secondly, what role do you think cross-sector collaborations between health, urban planning, and social services, also private sectors, can play in ensuring that mental well-being is integrated into the daily life and spaces of young Singaporeans alongside clinical care? Thank you.
Thank you very much. I would caution, well, a little bit of caution, not a lot, but a little bit of caution about looking at mental health as an explicit outcome of urban design, partly because it's going to be very hard to measure and attribute cause and effect. I think you can do urban design for well-being. I mean, you know which are the spaces you enjoy, you can see which are the spaces that people congregate in and have the opportunity to interact with each other. And all of those are useful and desirable. And I think that's the approach that I would take, that we do need urban spaces that people are happy to congregate in, that remain pleasant and well-maintained over many years so that people continue to congregate in them and have positive social interactions. And we then can downstream draw the link that an increasing number of those things probably leads to better resilience, well-being, and hence mental health. But I think it's a multiple causal chain rather than saying upfront put mental health as an outcome for MND or NPARC, let's say. So that's the first point. Second point I would say is that some of this already happens on a regular basis. So one of the pleasures and privileges of being a grassroots advisor and MP is having to then work with the community to then design common spaces. So I would encourage everybody to come to Punggol and have a look at our linear park and our common spaces around One Punggol, because that is an example of you have an area where the agencies have come together, MND, NParks, PA, and HDB. You want the community's input. So the agency officers have some input, the community has an input, and some of the input is at odds with each other. Do you want to create commercial spaces? Do you want to create playgrounds? Do you want to create senior-friendly? And you need an overlay, right? And sometimes that overlay, what is the strategic outcome that you want? You want, well, in this case, places where people can continue to congregate in a positive social way. Sometimes it may mean then you then have to say, well, let's have a little bit less commercial spaces. You need more multi-use spaces rather than specifically designating senior care or childcare, multi-use, for example. But then you have, and ultimately what we ended up having was a series of common spaces which were designed for people to get together outside their homes and free to use by the public. And so some of this work goes on already. I'm very appreciative that government agencies are willing to engage in it, and that there are community partners who can come along and give their inputs as well. So agree with the intent, suggest a shift in the labeling, and then I think maybe multiply some of the efforts that we are having already.
And Jillian here.
Thank you, Chairperson. Good afternoon, SMS. I'm deeply appreciative of this really, national effort to deal with mental health, but I'd like to just ask if we could zoom out a little bit and think of the people who are not in this room. And for them, what would you say to them if they say, why is it that the youth seem to be particularly mentally fragile? What is wrong, with the young people today? That's what they are saying out there. And they would be parents, would be employers, would be the less enlightened community leaders. What's gone wrong? That's what they're saying. So what's your message? And then to follow that up, I think we heard in the presentations, everybody saying, can we assure each other that we are enough? We are enough, And so my question is, apart from perceptions out there, what is it about things that may have changed in Singapore society, social change, that has caused us to start out by saying, we're just not enough? What are those things, and do you think that there's a game plan for all of us and politicians, everybody else, to kind of build a different Singapore where we start out and we say, we start out and we're on a growth trajectory and we will be enough for each stage? So who's taken away our confidence and our sense of we are enough? Thank you.
Thanks. Thank you, Julian. I'm going to push back a little bit. I'm not sure that I would agree that the young people of Singapore say that we are not enough and we don't have any confidence and we're no good. Actually, I think there is quite a lot of drive, quite a lot of passion, and there is some, I think, confidence. And I think there's some degree of self-confidence because what I see is that young people and youth groups want to do more for the rest of society, right? They see that there are vulnerable people, there are people who need help, there are people who have challenges, and they want to do things for them. To do things for others requires a certain self-confidence and drive. It requires a sense that I can do something, and I have the means, and I have a team or collaborators who can go out there and make a positive change in the world. So I'm going to disagree with you a little bit that there is a sense of doom and gloom. And I think actually it's the other way around, that young people and young Singaporeans in particular have a sense of confidence about making a difference in the world. They want to make a difference. But they also know that to make that difference, they have to persuade a whole bunch of other people. Which I think brings me to the first part of your question, which I do agree with, that older Singaporeans, perhaps people who are not in this room, who are not engaged in some of these conversations, might have a different view about some of these things. And there I start on the basis of trying to explain that this is not something peculiar to Singapore. And it's very important to understand that, because you need to then use that as a basis of understanding why we are having this conversation, why we have these anxieties. Actually, almost every developed society that I know of is having the same conversation. What is happening to the mental health of our youth? It's happening in the US, it's happening in the UK, it's happening in the EU, it's happening in Australia. And so if people are looking at it as a peculiarly Singaporean issue, we may overly focus on things that are unique to us, which don't happen in the rest of the world. But actually, if you understand that this is something that almost every developed and relatively prosperous society is going through, then we focus our attention on the things that we have in common. And why is it that we're all going through this together? So, I mean, people will point to PSLE or the DSA or whichever is the education stalking horse of choice. But the thing is, the UK, the US, the EU, they don't have the DSA or the PSLE. They do their education system in a fundamentally different way, but they have the same anxieties, and they also point to education stress as an issue. So it's not likely to be specific mechanisms within our education space that are driving something that is society-wide, although we have to tweak and adjust those policies for very good reasons. It's I think, a combination of factors. It's a combination of factors. One is that some of it is entirely normal for young people to go through. There is an uncertainty associated with that transition into adulthood. It is uncertain. You don't know what kind of education you should pursue. You don't know what kind of job you should be striving for. You don't quite know your relationships, which are working out, which are not. Who are your friends? Who are your long-term friends? Where are your significant relationships coming from? Secondly, the challenges of every generation as being distinct and different from their parents is a very real lived experience, and it's a real lived experience for every generation. I'm not so old that I've forgotten what it's like to be a teenager and to be absolutely convinced that my parents' generation had no idea what I was going through. And I'm sure it happened in the generations past as well. So that is, I think, a natural thing, but it is amplified, I think, by three or four broad pressures that all of these developed societies have in common. I would say one is this issue of, I mean, again, people have written about this, the idea of an extended adolescence. That the markers of looking after yourself, of being in an, where you are able to provide for other people, you've settled on your career, and you're living independently, and you are not engaging in ongoing development, education, right? The point at which that happens is just much later. And it's not a good thing or a bad thing, it's just the way the world has evolved. And I mean, I have children, teenagers, some, and my oldest is 21, and I can imagine, and I constantly, this is joke around the dinner table. When I was your age, it's like, oh, Dad's going to say that same thing again, and they roll their eyes at me, and I roll my eyes at them, and it's, well, but they live in a different world. And so there is an extended period of personal development leading into adulthood, and hence, the time frame when you are unsettled about where your life is going is just many more years longer than it was for my generation, and probably, therefore, many more years longer than it was for my dad's generation. Second pressure is that we have, as parents, the means and the interest to overparent. And that's what we do. We don't leave our kids, and we are less likely to leave our kids to find their own way. I mean, that's something that, it's a natural tendency for every family to try to want to do the best and then provide the advice. And like every parent, I will try to give advice until once they roll their eyes and I realize the best thing I can do is say nothing and let them find their own way. But it's very, very hard to hold yourself back when you think your child is not even not making the right decision, making a less than optimal decision, right? You still want to give that advice. And there's an article in the New York Times about mindful underparenting. Holding yourself back to allow your child to make mistakes and find their own way. And I think it's something that as the transition from my parents' generation to my children's generation has occurred, what has given us the means and the impetus? Well, we just know so much more about what makes a good upbringing and a good education and how to bring up a child. Our resources have increased quite significantly so that we can spend time intervening in the lives of our kids even though they don't want us to. And so I think that's a second pressure that is present. I would say the third pressure is the pace of change in the world. The expectation of what next year would bring, next 2 years would bring. There is a sense of uncertainty. There is a sense of, well, whether it's geopolitical tensions, whether it's about the threat of security and war, and so forth. People have to be actively reminded that the last 30 years of relative peace, relative slow and steady growth was an anomaly in our history. And now, actually, we are returning to a baseline of turbulence that had been present before. And those of us of a certain age will remember, before the Cold War finished, there was a certain sense of uncertainty in the world. These sort of boys' own encyclopedias would tell you what to do if the nuclear alarm was raised, and then, how you would hide in archways and under desks, and all these little nuggets of information. If you traveled overseas, you couldn't easily travel to certain parts of the world, and you had to think through about the safety and your health and travelers' checks and whether you had a phone number of someone you could call. The world was a more uncertain space. We went then through 30 years of really unparalleled peace, prosperity, and growth, and now we're returning to a little bit more of a turbulent age. Surely some anxiety about that is entirely normal. And then I would say the fourth pressure that all our developed societies is going through is an excess of information. And this is that whole social media always on phenomena. You just know about everything happening around the world as soon as it happens. And so some of that is unfiltered anxiety-provoking news. Some of it is social media and comparisons. I think we haven't quite fully understood the impact on the younger generation. We were having a conversation just now. I might repeat a little bit, but the analogy that I drew was that for young people today, having a social media account is like being a published author. When I was a teenager, which of my friends was known as a public figure and had information out there in the public? Very, very few. I mean, you had a few people perhaps that were part of a band that went around and were known as celebrities for some reason or the other. Someone who maybe had appeared on some TV show for whatever reason and then became famous, or someone who had been invited to do a journal article or a magazine article. A handful of people in my generation and as I was growing up were public figures. But today, everybody with a social media account has a public persona. It's like every single teenager, every single young person has become a published author as soon as they've logged on. That's the analogy that my generation has to understand, and that we don't quite yet know what is the impact in terms of behavior and anxieties, frankly speaking, on a generation that has grown up in this way. And so I think that is something that we need to spend a little bit of time thinking about. So 4 pressures. I don't think it's unique to Singapore. I think it applies to every developed society, and I think it behooves us to understand it as being generalized. I'm going to make one tangential point. Gillian didn't ask me this question, but it just, that last bit reminds me, which is your earlier point about what I do to deal with my own mental health. I delete social media apps from my phone. And I would highly recommend this to everybody. I don't have, I'm a politician, right? I have to have an online account. I have a Facebook, Instagram, etc., etc., etc. But I try very hard to make sure I don't have the apps on my phone. This started as a thing that I did when I went on holiday. I went on one holiday and I said, I'm not going to spend my entire holiday doom scrolling. So in a fit of pique, I deleted my Facebook and my Instagram account. I had a great holiday. Of course, my kids were like, sure, Dad, well done, come, I clap for you. They kept their Instagram accounts on their phones. But I had a great holiday, I had a great time. And then when I came back, because I have to go and kepo what all the MPs are doing and what's happening, I go and log on, right? But then this became, over time, a habit where every time I went on holiday, I deleted the Facebook and Instagram from my phone. And then what happened was, as I came back from my holiday, it was later and later before I reinstalled it. So today, I have, I've got the business suite, so I can upload stuff, I can, look at comments, I can make the accounts work, but I can't doom scroll. If I want to doom scroll, I have to sit at my desktop. I mean, it's not like I don't have access. I can sit there and I can easily be distracted from writing my next speech or my PQ answers, and I could potentially doom scroll on my desktop, but it's just much harder than sitting on your phone in the audience doom scrolling while some politician is burbling on with a microphone. Yeah. So I find that has helped my mental health as well.
I think that would be a pretty difficult thing for many of us here to do. In the interest of time, we just have time for just one last question. And the lady has been standing there for quite a bit. Oh, okay, cool.
Good afternoon, Dr. Janil. I'm Simran from the Majority Trust. I have 2 questions actually, but we'll leave it up to you to decide what to respond to in the interest of time. My first question is really, you shared today about the National Office on Mental Health. Obviously, there's been the Interagency Task Force. A lot of international practice also looks specifically at suicide prevention as an intentional kind of separate, distinct scope of work. So I'm curious to hear how suicide prevention specifically kind of factors into the national vision and agenda. And then on a slightly different note as well, today we've talked a lot about the importance of cross-sectoral collaboration, cross-agency collaboration, and having led actually the Interagency Task Force yourself, if there's any learnings that you can share with us as to what might ease some of these collaborations on the ground or across kind of levels. Yeah, would love to learn from that as well. Thank you.
Go ahead.
Okay, thank you, SMS, and thank you for letting me have time for the last question. I have a two-part. My name is Annie from GIC. I have a two-part question for you, and this relates to, I guess, a uniquely invisible population who may struggle with mental health or well-being in general, and that's the high performers. Right? That's your high performers in school and your high performers in the workplace. These are the people who deliver, maybe exceeding expectations most of the time, and in return get more responsibilities and more expectations. And here goes that high performers dilemma. And so with this group of people, my first part is there is often that tendency to feel or focus more on the perceived cost of admitting that you need help rather than figuring out actually what kind of help do I need, right? I'm thinking more of, is this going to cost my promotion? Is this going to cost my scope of work? Rather than actually what am I struggling with? So how do we maybe introduce more safeguards to lower these perceived costs of, what's it going to cost me if I voice out my areas of struggles? My next part of the question is, I think because it's invisible, because there's less willingness or incentive to say that I'm struggling, how do we better equip our managers or teachers to better spot these invisible but perhaps brewing signs of burnout, brewing signs of feeling like you can't do this anymore, and this sense of rumination, which is more and more common amongst high performers. Yeah, so for your consideration.
Thank you. Okay, let me try and deal with these four issues. They're all important, I must say. Suicide prevention is very much part of what we have been thinking about as part of the interagency task force and the work that we're doing. The difficulty with suicide prevention as a separate piece of work, well, it makes sense if you don't have an integrated approach towards mental health. So if you aren't able to pull together your education resources, your social resources, your clinical resources, then in some cities and in some settings, having a separate approach around suicide makes sense. But if you look at suicide as a problem, you have a few difficulties with dealing with it as a separate piece of work. The first is that 50% of suicide attempts, there is no antecedent at all. And for those where let me say that again. For 50%, there is no mental health issue at all. And of those where there is a mental health issue, if I remember my stats correctly, I think it's either 40 or 50%, that is the first presentation of a mental health issue. So in other words, you do not know who is going to engage in an attempted suicide and who is going to engage in an attempted suicide as a result of a mental health issue. And you do not a priori know of those who attempt suicide who has then a long-term mental health issue. If you then look at the factors associated with suicide, mental health is one of them. Social support is an important part, but so are community support structures, what happens in education, the family dynamics. And if you tease apart what looks like a good suicide prevention strategy on a population basis, basically you arrive at an integrated mental health and well-being strategy. So there is no daylight between the two as far as I'm concerned. And what we're doing around the interagency task force for mental health and well-being is very much in line with a suicide prevention strategy. One feeds off the other. The agencies that are involved, the resources that are involved are the same, and so we are paying quite close attention to this. You may be familiar with the numbers that suggested that there has been some improvement in our suicide risks. That I was very heartened when I saw that, and to put it into context, actually the numbers, I have not got the math in front of me or in my head, but they are better than people assume. Simply because suicide as attempts, as incidents, would depend on the population. And so all things being equal, as your population rises, the absolute number of incidents may well rise. And so for us to see a decrease is already quite a large delta. I mean, you know, we'd be doing very well to hold steady, but actually we saw a decrease despite a rise in population. Having said that, we shouldn't rest on our laurels. You don't go and say, well, Yahoo, everything done, job well done. Every single attempt is a tragedy, and we should be doing as much as we can to prevent. And we indeed are doing more together with the agencies. You asked about how we can ease this cross-sector collaborations. Well, there are many processes, policy platforms I talked about. There is some friction in this space as a result of the very fragmented landscapes. It's not a sector where people naturally say, well, let's all come together and rebrand as one organization. It's not going to happen, right? Every VWO, every religious organization, every institution that wants to do a bit of mental health would like to continue to have their identity. That's fine. And we have other domains and other industries where you have many, many service providers, but actually people are able to collaborate and cooperate quite well. So I think we do need to perhaps think of ways of, well, finding that community of practice to exist at different levels. There are some providers that have been doing this for many, many decades. We need to sort of learn their best practices, but they also need to then unlearn some of their suboptimal practices. So actually, so what can we do to ease that collaboration? A sense of humility all around, I think, including from the professionals who are writing the policies and the programs. We've got to learn about the operations and the services as well. Then there was the questions around high performers. It's not so straightforward to answer this. It's not so straightforward to answer this. Because the nature of this space is that it's not something that I think you're going to fix easily with a policy approach. You'll remember the story that Mr. Chen Kai-fong, the PS, talked about. And you'll remember the most important intervention was he described as someone very senior to him. You know, taking him out for tea once a week. And many people who are in that space that you described, high performers who then have mental health challenges, the support that they needs to come from a peer. Someone who can understand their theory of mind. Someone who can understand how they think and how they are challenged as a result of the work that they do. So that's not going to come from general assistance. It means that you need some support structures within your workplace, within your professional circle. You need friendships, you need buddies, you need comrades whom you can turn to. How do we equip those people then with the right set of skills and values? So it's very much the same as what we're doing with the whole population, that we want this idea of peer support, that we want to have general listening skills, a general set of values and ideas about being available for your friends and being available for your colleagues. There's a concept called Sonder. I don't know if you're familiar with this, but the mental health professionals will talk about this concept of Sonder. And it's this idea that each of us has a very rich internal life, right? You sit there and you worry, like, what does Gillian think about me? And is Kenneth having to rebut me? And I have this internal conversation, this internal dialogue, and what my kid's doing. And you have a very clear sense of your own internal motivations, internal anxieties, and everything else that's going on in your world. But all you know about the other person is what they say to you and what's on their face and what you read. And sometimes what you need is something to trigger an understanding that everybody else's internal life is just as complex as yours. And everybody else has their anxieties and has their struggles and has their difficulty navigating the world. And it's a little bit of, I am not so special. I'm not so special in a negative sense. That idea of Sonder. It's an important threshold to cross when you are dealing with, from a therapy perspective, when you're dealing with people who are struggling with some of these things. And for high-performing individuals, it's an important threshold to cross in terms of understanding that you can reach out for help. Because one of the greatest difficulties for high-performing individuals who have mental health challenges is that anybody can help them. And you need to be persuaded that you you can have some help. So not so easy to solve. I think it's something that different industries have to take into account with the high-performing individuals that they have within their team. And so I think it's going to be very domain-specific. It's something that we pay some attention to in my previous profession, in healthcare, for example, when we were training our colleagues in the pediatric intensive care unit. You can imagine it's a place where there are a significant number of mental health challenges for the professionals that are there. And these are high-performance individuals. I mean, these are people who, the reason we hired them is because they can do this very difficult job. And you need to then train them to seek help. And you can't do it head on, you know. A lot of it is because you, as the head of department or as the senior physician, you get them into the habit of having coffee with you after the ward round. And, you know, a lot of it starts off as informal training and teaching about the patients, but actually over time it becomes a support system. An informal, low-risk support system because there's nobody there with a report, nobody's taking notes, nobody's taking minutes, but it turns into that type of approach. Now, if I label those coffee sessions as mental health support, I can guarantee you none of my residents would turn up. None of the trainees would turn up because they want a job from me, they want an A grade from me. And so I can't say, I'm having coffee with you after the ward round because I'm looking after your mental health. I can't say, I'm training you to deal with burnout when you become a consultant one day and you have to deal with all of these things. And so some of this is domain specific, and this brings me to your last point, is how do you equip the managers to then deal with some of these issues? And I think it is about putting that mental health conversation into professional development. And I think increasingly, this is being seen as an issue. In some professions, so for example, aviation, security services, defense, things which are naturally understood as high risk, they've been thinking about this for a long time. But increasingly, this is now coming into other professions. And again, you heard Kai Fung talk about how the civil service is talking about this, right? I mean, the civil service wouldn't be, you're not carrying weapons, you're not piloting a plane, you're not dealing with, but it is increasingly being seen as a part of a competency of leadership within that profession. And I think that's where you have to take the conversation. How do you persuade each domain of employers and professional development that a core competency of leadership is dealing with the mind and the cognition and the mental health of your juniors and your trainees? And I think that's how we have to shift the conversation. I think it is actually happening. The reason I say I think it's happening is because if you are a training provider, some of you may be from organizations that provide training, you will know that increasingly people are coming to you to say, come please train my managers, come please train my directors, train my leadership in these competencies. And there is a demand for this, which I think we can continue to usefully fill. So thank you all very much for a very interesting set of questions and challenges, and I would encourage you all to continue to be part of the mental health ecosystem as we take these strategies forward. And thank you very much for moderating this as well. Thank you.
Thank you to SMS.